When we reach old age, we always hope to live peacefully, happily with our children and grandchildren, enjoying the sweet fruits after many years of hard work. But many people are facing a storm called cancer, a key word that makes anyone shiver, no matter what age. Especially for the elderly, when their physical condition is weak. Their psychology is even more sensitive. The two words cancer are no different from a death sentence read slowly. However, what makes the elderly afraid is not just cancer. It is the feeling of having life taken away from them, the confusion when the future becomes unclear. It is the moment when looking in the mirror, seeing that you are no longer the same as before. It is loneliness, when your children and grandchildren are busy, and you are torn between hospital, home, chemotherapy. There are people who say, "I am not afraid of dying. I am afraid that living is just a burden." That is the silent pain that not everyone understands. However, today, medicine has come a long way. Cancer is no longer synonymous with death, especially when detected early and treated properly. It is important to understand that cancer in the elderly does not mean that life has ended. It is a new journey, difficult, yes, but still surmountable with faith, companionship, and the right knowledge. Join us on a journey to discover the truth behind the fears, the misunderstandings, and how the elderly can face cancer proactively, not with panic, but with strength and love. 1. Why do the elderly often feel like they are being sentenced to death when they hear the news of cancer? When an elderly person is diagnosed with cancer, the first feeling is often not hope or struggle, but collapse. For many people, it is like a death sentence handed down to their face, causing all faith to be swept away in the blink of an eye. But why is that? The reason lies in both physical and psychological factors, in life experiences, and long-established social prejudices. First of all, the elderly tend to view illness through a more negative lens than young people. Throughout their lives, they have witnessed too many people die from cancer, especially when medicine was not as developed as it is today. Therefore, in their subconscious, cancer is always synonymous with death. When the doctor says those three words, the elderly not only hear the name of a disease, but also hear the death knell echoing from the past. Second, the elderly often feel tired and lack the motivation to fight. After a lifetime of working, their health is now declining. Many people have become accustomed to daily aches and pains. When another serious illness like cancer appears, they tend to give up, thinking, "It's about time." They do not want to be a burden to their children and grandchildren, and even feel that death is a release, rather than something to fight against. Another underlying cause is loneliness. Many elderly people live alone or receive little care or conversation. When they get cancer, they not only face physical pain, but also have to fight in emptiness. Without anyone to share with, no one to encourage, how can they keep their spirits up? Isolation makes the disease even more frightening. Finally, we cannot ignore the rampant negative information. Articles, stories, and even movies often portray cancer as the end. Older people are less able to filter information and are easily influenced by tragic images. When they lack modern medical knowledge, they are more likely to equate a cancer diagnosis with preparing for the funeral. All of these factors add up to a huge psychological burden, making the elderly feel like they are being sentenced to death just because of the three words cancer. But the saddest thing is that this feeling is not necessarily true, because with the advancement of medicine, cancer is no longer the end, but the beginning of a new journey if treated promptly and properly. 2. The truth about cancer in the elderly. When a person reaches the age of 60, 70, or even 80, the word cancer sounds like a sentence that closes their life. But is that completely true? Does getting cancer at an older age mean that there is no hope? The truth is, cancer in the elderly is not the same as cancer in young people, from the way the disease develops, how it is treated, to the ability to recover. Each has its own nuances. First, being old does not mean that it cannot be treated. Many elderly people, upon hearing a cancer diagnosis, immediately refuse treatment because they think, "I am old. Why bother with treatment, and it will be more expensive and painful," or even their family ignores the decision. But according to statistics in countries with developed medicine, many 70 to 80-year-old men and women still live healthy for another 5, 10 years, or even longer after treatment. What matters is not how old you are, but your overall health, the stage of the disease, and the appropriate treatment options. Second, many people do not know that common cancers in the elderly often progress slowly. For example, prostate cancer in older men can live for many years without the disease becoming serious. Many doctors even choose to monitor instead of treat immediately, knowing that the patient's natural life expectancy may be longer than the time it takes for the cancer to develop to a dangerous level. Third, modern technology and medicine have opened many doors of hope. With the advent of targeted therapies, immunotherapy, highly precise radiotherapy, minimally invasive surgery, the elderly no longer have to go through exhausting treatments like before. Many geriatric oncologists also recommend that, if the patient can walk, eat normally, and does not have a serious underlying disease, then it is completely possible to consider active treatment. The next truth, which may be surprising, many elderly people live well with cancer as a chronic disease. Like high blood pressure or diabetes, stable stage cancer sometimes only requires regular monitoring and supportive medication. Thanks to good care, adequate nutrition, and an optimistic spirit, they still live with their children and grandchildren, play, travel, garden, and laugh like they did before the disease. In addition, it is necessary to consider a psychological factor. The fear of cancer often comes from a lack of information. Elderly people often do not update medical news, are rarely explained thoroughly by doctors in easy-to-understand language, and easily become confused. Children are busy, or sometimes do not know how to share. This makes patients imagine the worst situation. Therefore, the most important thing is, do not despair. Learn carefully about the type of cancer you have. Ask your doctor clearly. Seek more expert opinions, and especially keep yourself calm. With your loved ones, you will realize, cancer is no longer the end, but a new journey, full of challenges, but not lacking in hope. Cancer in the elderly does not mean the end of life. On the contrary, with appropriate treatment, good mental care, proper nutrition, and love from family, the elderly can still overcome, live meaningfully, and spread love until the end of the journey. 3. Help the elderly overcome the psychological shock of a cancer diagnosis. When an elderly person receives a cancer diagnosis, the shock is not just physical. It is a mental earthquake. At an age when people often think of rest and peace, this information is like an invisible sentence that destroys all remaining hope. Feelings of fear, confusion, and even despair are completely understandable. So, how can we help them overcome this psychological shock? Listening, the first and most important thing. The elderly need to be listened to, rather than advised or taught. As soon as they hear the news, most of them will fall into a state of defensive psychology, denial, silence, anger, or crying. These are completely normal reactions, part of the process of accepting reality. Families should not try to dispel those feelings immediately, but should listen with empathy. A few simple statements like, "I understand how you feel right now. You can say anything. I'm here to listen," can make a big difference. Older people don't need quick advice. They need someone there, patient and sincere. Explain the disease clearly, in the right way, at the right time. Many older people feel like they've been sentenced to death because they don't understand the disease. They often associate cancer with death. This makes them even more afraid and distrustful. Therefore, relatives and doctors need to explain the disease in a way that's easy to understand. What stage is the cancer? Is it curable? What is the survival rate, etc.? Emphasize treatment options and realistic expectations. Avoid using overly technical or dry language. This can make them more confused. For example, instead of saying, "You have stage 3 pancreatic cancer and need 6 rounds of chemotherapy," you can say, "You have a tumor that needs treatment, and we have methods such as medication, radiation therapy, etc. to control it well." Face it with them. Don't leave them alone. Loneliness is the biggest enemy of elderly cancer patients. Many people hide their feelings, not wanting to be a burden to their children and grandchildren, leading to depression. Families need to proactively accompany each step. Go to the doctor together. Sit by their side when they are undergoing chemotherapy or in the hospital. Eat together, chat every day. Simply being present, without having to say too much, can create a sense of peace for the elderly. Seek professional support if needed. If the elderly person shows signs of prolonged depression, insomnia, panic attacks, or refuses treatment, the family should seek help from a psychologist. You can consult with a local cancer support group or a mental health service for seniors. Counseling can help them understand their emotions, learn to adjust negative thinking, regain calm, acceptance, and hope. Give realistic hope. Don't exaggerate things, but don't let them lose hope either. Families can talk about cases of recovery or older people who are still healthy despite cancer. The important thing is to inspire the will to live. For example, there's a woman in her 70s who is still doing well with treatment and is still healthy. The doctor said that my father's condition can be well controlled if he complies with treatment. Hope is not an empty promise, but a small light that helps them get through the darkest times. Encourage them to maintain healthy living habits. A healthy mind will be nourished by a healthy body. Families should encourage them to eat a nutritious diet. Do light exercise every day. Maintain hobbies such as reading, gardening, painting, listening to music, etc. These activities help them reduce stress, stay optimistic, and feel that they are still living a valuable life. Overcoming the shock of cancer in the elderly is a journey for the whole family, not just the patient's job. Patience, companionship, clear information, and realistic hope will be the pillars that help the elderly overcome this difficult journey. If you have parents or grandparents who are elderly and facing cancer, don't let them fight alone. Be their spiritual support, their light to help them believe that cancer is not the end, but just a new turn in the journey of life. 4. When to treat, when to palliative care, helping seniors and their families make the right choices. A cancer diagnosis in seniors often comes with a host of troubling questions. Should we treat aggressively? Can we tolerate chemotherapy and radiotherapy? Should we accept living with the disease and focus on palliative care? Each person has a different story, but making the right decision requires understanding the two paths: aggressive treatment and palliative care. Aggressive treatment, when is the right choice? Many people think that if I'm old, why bother with treatment? But in fact, age is not the only factor that determines whether or not to treat. More important are the patient's overall health, stage of the disease, and wishes. General health status. A 75-year-old man who is still alert, has stable blood pressure and heart rate, and does not have serious chronic diseases can completely tolerate a standard treatment regimen. On the other hand, a 70-year-old woman with chronic obstructive pulmonary disease, kidney failure, or diabetes complications may be at high risk when treated. Stage of the disease. If cancer is detected early, the chance of cure or long-term control is very high. Even in the late stages, treatment can still help reduce symptoms and prolong quality of life. Personal wishes. Some older people have a strong fighting spirit, willing to face difficulties to prolong their time with their families. Meanwhile, others just want to live peacefully, without pain. There is no right or wrong, only the right choice for each person. An important thing to remember: treatment does not necessarily mean fighting to the end. You can choose targeted treatment, symptomatic treatment, or just partial treatment, as long as the patient feels comfortable and satisfied with that decision. Palliative care. Not giving up, but complete care. Palliative care is often misunderstood as giving up. The reality is completely different. This is a humanistic medical approach, focusing on reducing pain, discomfort, providing psychological support, and ensuring the best possible quality of life for the patient and family. When should palliative care be a priority? Cancer is spread, no longer able to be effectively controlled by medical treatment. Poor health, unable to tolerate the side effects of treatment. The patient does not want to continue treatment because of fear of pain, fatigue, or has mentally prepared to accept the disease. Palliative care is not just painkillers. It includes nutritional care, psychological support, treatment of symptoms such as nausea, shortness of breath, insomnia, and especially accompanying the family in each stage. For the elderly, palliative care can bring extremely meaningful values. Relieve physical pain. Late-stage cancer often causes prolonged pain. A proper care regimen will help the patient feel more comfortable, reduce anxiety and fear, preserve dignity and autonomy. No one wants to end their life in pain and dependence. Palliative care helps the patient to leave in peace, with control, and without feeling like a burden. Emotional support. Many patients feel listened to, respected, and accompanied, something that strong treatment regimens may not be able to do. Combine both, flexible choices, no rigid boundaries. Nowadays, many doctors recommend combining treatment and palliative care, especially for the elderly. Palliative care can start from the early stages to support symptom control, support the spirit, and help the patient maintain good health throughout the treatment process. Even after the end of active treatment, if the disease progresses, the patient can still switch to palliative care gently, without psychological shock or interruption of care. The decision should not be forced. Whether choosing treatment or palliative care, the most important thing is the consensus and understanding between the doctor, the patient, and the family. Do not force the elderly to receive treatment when they do not want it. Nor should you miss the opportunity for treatment when they still have enough strength and fighting spirit. Ask them, what do you want in the future? What is most important to you, life expectancy, quality of life, or both? What kind of treatment do you want, aggressive or gentle? The right choice is a choice with love. Cancer is not the end. The most important thing is to help the elderly live their last days, whether 1 year or 10 years, in peace, proactively, and with respect. Whether aggressive treatment or palliative care, as long as the decision comes from understanding, love, and the best wishes for the patient, it is the right decision. Cancer in the elderly, it sounds like a death sentence, but it is not. What makes the elderly feel confused and depressed comes not only from the disease, but also from the feeling of being abandoned, the fear of losing dignity, or the burden placed on the shoulders of their children and grandchildren. However, the good news is that today's medicine has made great strides, not only in cancer treatment, but also in psychological care, pain relief, and improving the quality of life for elderly patients. Cancer doesn't have to be the end of the world. For many older adults, a cancer diagnosis can be a positive turning point if they accept it, make lifestyle changes, and get the right support. An older adult with cancer doesn't have to fight it alone. They need the support of their family, their healthcare team, and their community. It's important to get the right information, understand the disease, determine your treatment options, and discuss aggressive treatment or palliative care with your doctor. Every decision should be based on respect for the patient's wishes, physical and mental fitness, and the quality of life they want. And if you're in this situation, as an older adult, or as a child or grandchild caring for a parent with cancer, remember that you're not alone. Get informed, talk to a geriatric oncologist, join a support group, and don't be afraid to share your feelings. Understanding the psychology of older people with cancer is the first step to helping them live better. Not fighting, but living meaningfully every day. Backhand index pointing right, please share this video if you find the message important. Don't forget to subscribe to receive more content about elderly healthcare. And if you need medical or psychological advice, leave a comment or inbox us. Our team of experts is always ready to support you. Cancer is not the end, but can be a comma to start another journey of life, peaceful and full of love.